Hello and welcome to the board film to give you an update of the topics we talked about at the March Trust board meeting. This board meeting, like every board meeting, we started with a patient story, and we were welcomed Janine Valentine, our nurse consultant for dementia, and Trish Fors, our dementia coordinator, who came and gave a very positive story about how we'd cared for a very complex patient with difficult dementia, and it really exemplified to the board how our focus on dementia is so important as we move forward as an organisation and the age profile of our patient increases. Dealing with complex dementia patients is going to become ever more important to us, and this was a really good example of how our teams had worked very creatively to come up with a really good solution for caring for this patient at a very difficult and traumatic time for him when he came into the hospital. It was also very opportune to have a patient story focused around dementia, as we also yesterday opened our new ward 6A, which is a trauma ward but has been designed to be specifically tailored to meet the needs of dementia patients. And we were very pleased to welcome Michael Evis, the Glastonbury Festival organiser, who came and opened the dementia ward and also spoke very warmly about the care his mother had received when she'd been a patient here at Yeovil Hospital. So it was a great opportunity to have a real focus for our board meeting on dementia as our patient story. In my Chief Executive's report to the board, I was able to update on a few key strategic issues. First of all, we were able to update on a successful bid that we'd made to the NHS England Nurse Technology Fund, and this is a fund of money made available to support new innovation in technology for nurses across the NHS. And we are one of only 2 hospitals in the southwest that has been fortunate enough to be granted money to support a new technology which we're going to be implementing to provide electronic method of recording observations at the bedside. And we are just about to procure a new solution called Vital Pack, which will enable nurses to be able to record all of the observations on electronic devices, so it will mean replacing our paper observation reporting. And it's a big step forward for us in terms of our move towards electronic health records within the hospital. And we've been fortunate to be awarded £300,000 of money from NHS England to make this happen, and we'll begin the rollout of this in the next coming few months. The second item I was able to talk about was our recruitment for our Director of Organisational Development and Workforce to replace Mark Power, who left us recently. We had interviews last week with Dorchester, because this is a joint appointment with Dorchester Hospital, and we have a preferred candidate that we are working with now to negotiate final terms, and we would hopefully be able to communicate more widely towards the end of next week about our decision on that post. And finally, we also talked a bit more at the board about our relationship with Dorchester County Hospital. We already have a very good relationship with them, and we're exploring opportunities to further develop that relationship, to look at how we can continue to build on some of the existing things we've done, such as the shared post of head of midwifery, and thinking about other clinical areas where it may be appropriate for us to work in collaboration and look at how we can share more resources between our organisations, which is going to become particularly relevant at a time where NHS finances become ever more squeezed. How we collaborate with other NHS providers is going to be really important for us in terms of our future sustainability as an organisation. Helen Ryan, our Director of Nursing, was able to update the board on a number of key areas around patient safety and quality, which were really good to hear about. First of all, we are on target to reduce our pressure ulcers acquired in hospital by 40% this year, which is a really positive step forward, and many thanks to all of the ward nursing staff and others who've had a real focus on this area, which is so important to our patients. Secondly, our falls. We again are on target to reduce our falls by 10%, so falls of patients within hospital, and again this is an area which I know the nursing teams across the Trust have been really focused on. And also really encouraging to hear the positive news that we are on target to meet our trajectory for a reduction in C. difficile acquired infections in hospital. We have a trajectory we should only have no more than 9 this year, which we're just ending at the end of March, and we're currently on track for that. And also really positive is that we are now over a year since our last hospital-acquired MRSA infection, which again is a really positive support for the work that's been done in not just the way we prescribe antibiotics and things like that within the hospital, but also how our cleanliness is constantly monitored and improved. And I must give a big thank you to all of our staff in our housekeeping and domestic services team, who obviously play a key role in making sure that our environment is kept clean. And Helen was updating the board on the cleanliness audits that have gone on across the hospital that really showed we've made significant progress in our cleanliness across the trust. So well done, and thank you to everybody who's played their part in that. At this time of the year in March, we're coming to the end of the budget financial year, so obviously we talked a lot at the board this month about our year-end position. We're on track to deliver a small surplus this year at the end of this financial year, which is a really positive achievement, particularly given the challenging financial picture we've had to deal with this year. Obviously, looking forward also, the board was discussing the budget for next financial year beginning on the 1st of April, and this coming financial year is going to be a real challenge for us financially, probably more challenging than any other financial year we've experienced to date. Looking forward into 14-15 financial year, we're going to have to deliver CIP savings of around about £3.5 million, which is pretty much on line with what we've delivered this financial year. But we know that it's going to be ever increasingly difficult to find those savings as we go forward. And at the moment, there is the way the budgets are panning out for the next financial year, it may look that we are actually in a deficit position for the first time in a long time next financial year. Now, this is partly driven by the increasing cost pressures that we're experiencing as an organisation, as costs for things like drugs, pay costs increase at a time when the income that we're receiving is either static or in some areas reducing. So you can imagine that it's a really challenging position that we're facing. But I should emphasise, this isn't a position that is unique to YDH. This is a position that's currently being felt by very much a lot of hospitals across the country. And indeed, we are in a better place than many hospitals in terms of the good work that we've done so far to maintain a strong financial position, but we're working hard to see if there's any way we can minimise that deficit in next year, and the finance team and colleagues across the hospital are working internally and also with our commissioners to look at what we can do to try and manage that going forward. But you can imagine it's going to be a very, very challenging financial position next year, and I'm sure many of you will already be having conversations with your business managers, finance colleagues, about how we manage this tricky financial position going next year. So we will be updating further through our staff briefings on what that will mean for us in the hospital in the coming months. In the final part of the board in the afternoon, we had a seminar session where Jeremy Martin, our project director for the Symphony project, came and updated the board on the work that we're doing to work in a much more integrated way across hospital, community services, with local GPs and with social services. And we're making real progress on that agenda to really look at how we can design a model of care for patients where the most complex patients are cared for wherever possible, at home, with the appropriate support from their local GPs and community services. And going back to our financial challenges, really the only way we're going to be able to tackle the growing demographic challenge facing us with an ever-increasing elderly population is by if we work collaboratively with GPs, community services, and look at how we use our collective resources in a better way. And it was really heartening to hear the progress that's being made through the Symphony project on that, and that we're now starting to really get into the implementation phase of how we develop a new care model, which is very much focused on integrated health and social care teams in the community, with input from specialists in the hospital, to try and care for those patients, most complex patients, in a very different way. And it was also really fortunate that while we were when we had that presentation from Jeremy, we were also fortunate to have a visit from the Vice Chairman of NHS England, the national body that oversee the NHS. And he had come along to hear about what we were doing in Yeovil and with our partners, and left feeling very positive that we had a very innovative and different way of approaching the challenges facing the NHS, and was very, very much taking back the message to London and to NHS England that places like Yeovil and South Somerset have got a really ambitious way of tackling the challenges in partnership with their colleagues across the health system, that he felt was very much an exemplar for other health communities around the country that they should be learning from. So it was really encouraging to have his endorsement for our strategy and way forward, and also a recognition that what we're doing here is very innovative and different, and is hopefully going to bring about real change to the way we deliver care to our local population. So that was a really positive endorsement, and also positive conversations with our board about how we, as the hospital, have a really key part to play in that. So it was a really, despite the challenging financial pressures we discussed at the board meeting, it was also a real positive end to the board that we were able to say, well, despite all of that, we believe that we've got a really strong strategy that can position YDH in a really good place going forward, and will provide a strong, sustainable future for the hospital as part of an integrated health and social care system. So that was a really good meeting in the afternoon, and really presented a positive outlook for us as an organisation. So as always, if you've got any questions on what you've heard today in this board film, please get in contact with me directly or through the communications team, but we'll look forward to giving you an update on progress at the next board film as usual. Thanks very much.